Yeah. Okay. Well, welcome everybody. This is exciting, and I think it's great that everybody's here, joining this Zoominar or whatever it's best called to talk about some of the things we, particularly our faculty, are working on that are related to the issues in the world today that are surrounding COVID-19 and the pandemic and all the unusual and unique events that we've been dealing with over the last month. And it has been about a month now since we've all been working at home. First, I want to thank Tanya for putting this together, Lisa for moderating, and our panelists who are going to talk a little bit about what they're doing. I think, the School of Public Affairs wants to be useful. We want to be useful to our students, of course, and teaching our classes and training them for the world of the future, but we also want to be useful to the community. We're not the School of Public Health, which is probably at the forefront of dealing with this in terms of their faculty and the work that they do being so tied to the pandemic, but we have a lot of important perspectives on domestic violence, criminal justice, network analysis, public policy generally, and the research that our folks do in this area and these areas are important always, but even more important now. And we wanted to take this chance to both communicate and sort of join in a Zoominar kind of way with each other, but also hear from our folks about what they're doing, what they're working on, what their perspectives are about this incredibly bizarre and unique world that we're living in right now. So with that, I'll kick it back to Lisa to get things going. And again, thanks for being here.
Thanks. So I'm really pleased to be able to talk today and really learn from these 5 wonderful faculty that have joined us today. And as I was thinking about preparing, I was thinking about the book, The Art of Uncertainty. And in that book, the author, Dennis Merritt Jones, he proposes that instead of approaching uncertainty as a problem, that we should approach it as a mystery, and that opens our minds up to curiosity. And so today we are going to be curious and be thinking about what are all of the potential impacts. So in framing this, we've asked our faculty members to share their observations and their thoughts and to explore, maybe even pontificate with their expertise, but not to create a special presentation. So this will be informal and again, just in this space of curiosity. The conversation is going to occur in sort of 3 rounds. So we'll start with a little bit of a focus on the immediate response to COVID. We'll talk then about some of the consequences of that immediate response. And then we'll talk a little bit about the transition into recovery and the future, and then we'll have time for questions. So let's get started. Today we have with us Deserai Crow, Danielle, Varda, Barb Paradiso, Paul Taylor, and Chris Weible. And I'm going to start with a question for you, Deserai, if you wouldn't mind kicking us off. And we'd just love to hear, what do we know from your research and work that could help inform some of these immediate decisions that are being made about the response right now?
Thanks, Lisa, and thanks, Tanya and Paul, for kicking us off, and Tanya and Lisa for organizing this. For me, it's always somewhat cathartic to bring my research into into focus around crises events, because it's a way that I personally help try to organize and understand the world around me when it's so chaotic and so stressful, just on a very kind of human level. And that's actually what catalyzed one of my big projects that my collaborator and I are working on a book manuscript now based on an NSF project focused on disaster recovery in communities. And our work looks at how local governments in particular learn from disaster events to do better going forward, to change policies and to become more resilient. And so from this work, there are quite a number of lessons that I think are relevant to talking about COVID and how governments, both state and federal governments in particular, are responding well and less well sometimes in the face of this crisis. In particular, I want to highlight a few lessons from our work. One is that government relationships matter. And I think there's no clearer example than the conflict that surrounds the federal-state relationship in a number of cases right now, whether it's New York with Governor Cuomo and President Trump, whether it's Colorado and Governor Polis's comments about how FEMA has swooped in and taken ventilators, and FEMA is coming back saying, no, we never did this, and so forth. And that level of trust or lack of trust between government entities in this instance, we argue in our book, is a really key part for local governments being able to respond to disasters, because they're so reliant on perhaps mutual aid agreements with other local governments and then state and federal governments above them for resources and help and funding and so forth. But in this instance, we see it really among state governments and between the states and federal government in how those relationships can be functional or dysfunctional. And we've seen a number of states opting out of really relying on the federal government and creating these consortiums, like the West Coast group of California, Washington, and Oregon. And then we've seen it in the Northeast, and now even some Midwest states doing the same thing, creating these networks where they have previous relationships or kind of similar cultures or what have you, that allows, and I think those are great illustrations of the importance of positive government relationships. And then going a bit further kind of on the interpersonal level and individual level, if we take that idea of relationships and trust individually, the degree to which, in our work, the degree to which individuals trust their government and trust their government as sources of information during a crisis is really key. And we've seen a number of studies that have come out over the last month in particular that shows that Americans have a very low level of trust in the federal government as a source of information about COVID right now. And that is, we can speculate, but that is due in part to kind of I would say kind of the spattering of information, the kind of contradictory information we're seeing from the same sources over time changes a lot, and therefore it's hard to know what to trust as an individual. We also see that trust in government as a source of information right now is really divided based on your own political ideology. And that wasn't necessarily the case at first, but as we move along in this crisis, that's increasingly a predictor in how much you trust government and trust the federal government in particular as a reliable source of information, which during a crisis is that's always a concern when we talk about how individuals trust their government. But during a crisis, that's a particularly concerning finding, given that we need individuals to trust what their government is saying, to trust that their government's doing the right thing to keep them safe and to make decisions. And as we're seeing more and more pushback on these stay-at-home orders and so forth, that's really coming into clear focus, that whether or not we trust our government is really key in whether or not we trust the policies that they're enacting on our behalf to mitigate the risks of COVID and so forth. And so currently, I'm working with a group to submit an NSF rapid grant that really looks at this idea of in this moment in time, as we have this emerging novel risk that's new to all of us, so we're not kind of mapping our prior beliefs onto it necessarily, like we might with climate change or wildfires or other risks, what government communication messages are doing, how they're influencing our own individual beliefs and support of policies, but also as we start to see in the next few weeks, as governments kind of relax those policies, as we're starting to see states and counties remove those stay-at-home orders and so forth, how government communication changes and how we might see the relationship between policy, ideology, and demographics and the risk communication messages. We're going to hopefully be following that over the next few months, because obviously, as we've all heard, public health officials expect that it's not just going to go away, that we might see kind of new new spread and new outbreaks of COVID-19. So those are some of the ways in which I look at a crisis like this, and I think lessons that my prior research brings to how I understand this. But I'm happy to talk more and take questions at the end.
Thanks, Deserai. One of the things I love about this panel is that there's some ribbons, I think, that we'll hear of similarity, and then just some real differences, the expertise that you all bring. So next, Danielle, I think we'd love to hear from you. Again, same question. What do we know from your research and work that could really help inform, or is already helping inform, the decisions that are being made about the response today?
Yeah. Well, thanks, Deserai. That was amazing. I love having this opportunity to hear from everyone. So this is going to be fun. I think I'll start by saying never before in my career or life have systems and networks been more relevant to just every single person on the planet. Lisa and I were on a webinar earlier today, and I said it there too. My dad is talking to me about systems. I'm not sure that we agree on where our systems are going, but it's been remarkable to me. And for that reason, the work that I've spent a lot of time thinking about and working on around systems building and social connectedness and in network science has really popped up. So I feel like we've been just busier than ever. And the connection between network science and COVID-19 played out really early when a lot of network scientists were talking about how disease spread. And, we use a lot of concepts in network science to think about diffusion in networks. And those early days of the pandemic, when people were trying to really figure out, people use the term vector a lot, like trying to figure out how, and we saw those graphics pop up and, all the news stories to show all, the way things spread. All the network scientists were getting really excited because we were going, yeah, that is the thing we've been thinking about for so long. I started work in pandemics when I worked at the RAND Corporation. In fact, my first paper I ever published was on using data to inform policymakers in pandemics. And from there, I've done many studies, even till just recently last year with RAND around networks, and published a paper once on social network analysis methods in the study of disasters after work we did in response using funding from a rapid grant from NSF after Hurricane Katrina, and established a framework that a few researchers from around the country have called on to ask and talk through about how to use the application of social networks in the study of disasters. And we have this kind of in-out, I forgot the terminology now, the provider and it's called the in-out seeker provider framework. And really how in the study of disasters, there's really lots of different ways that we are thinking about social connectedness, both for the providers, which is happening now, also the people affected by it, and how those relationships are both impacted by those we're being connected by and those that we're connecting out to. And fast forward a little bit, after our Hurricane Sandy with RAND, while a professor at the school, we did work on recovery networks to look at how recovery networks changed over time. And we published a toolkit for how to use our partner tool in the study of recovery networks. And so what's been really fun over the last few weeks, and certainly overwhelming, is the number of people who have reached out to say, can we use that toolkit right now? What could we do to understand both the micro networks of people and informal things that are happening on the ground in communities, but more aligned, what I think a lot about is how those interorganizational networks that were already in place around the things I've studied for a long time, which are usually public health networks, are being activated right now. And how, so we finished a project with Todd Ely and on a Robert Wood Johnson Foundation project just last year with a Systems for Action grant with these communities in Texas and Florida on the carrying capacity of their communities to absorb resources or referrals on social determinants of health from the health sector. Those same communities, I've had 2 calls with them now, are calling and they're asking, how do we capture this moment of time? And how do we understand what's evolving? And then most importantly, how do we use that data to understand how to inform policy going forward? These are both shared space social service, like human service centers, and they use the terms right now, they're getting hammered. And they're overwhelmed already by, and one of them was talking about how, judges and the sheriff were calling him to say, I have so many people in need. Do you know what to do with them? And he said, yes, we do indeed know what to do with them, because that's what they do. But he said, the same thing, never before has he been so certain that having trusted networks in place are important for the future. So one of the ways in which I think things are kind of going forward, I've been working with a lot of folks either on helping them, consulting with them to help them stand up these new networks. For example, a group of pediatricians that are being asked to perform adult ICU care right now have formed a national network to try to just build those resources together. And so they've asked us to help them with just the ins and outs of building that network. And the VA, we're part of some thinking with them about how, being in social or self-isolation is impacting the social health of veterans. But most importantly, and the last thing I'll talk about is we've been really excited because what we do in building tools and technologies and data systems is a natural fit for tracking networks on the fly. And so we've built a prototype of using our partner tool for collecting data for screening patients and those infected on their contact to build a contact tracing network. And the screener feeds right into a data platform. And we're working with the state and other states and several different kind of opportunities to work on the test use cases for applying that. And all it really does is it gives that really hard work of tracking people's networks that is usually done with like paper and pencil. And I mean, I've been reading estimates like crazy. It can take up to 30 hours a person. It turns it into a very, very systematic, fast process where someone can just put in their data and the data system holds it. And so my hope is to be of service to the state and of service to public health right now, where we can provide them with a tool that we hope will actually make a difference and an impact for when we can open the community again, and when we can, and how we can hopefully prevent infection and save lives. So I've been really busy, I think, in trying to sort out like where to land on putting resources into helping communities right now in their response.
Thanks, Danielle.
Yeah.
So we also know that a lot of our work is maybe not the immediate response, but it's actually because there are so many consequences to the immediate response. And so we're going to move there. And I think start, Barb, if it's okay with you. And you've been already published in a wide variety of media on this topic, but would you share with us, what do you know from your research that is helping make decisions about some of these consequences, expected and perhaps unexpected, of the immediate response to COVID?
Sure. Thank you, Lisa. So yeah, the first response, the primary response that of course is happening across the nation and across the world are stay-at-home orders. And when you ask people for whom home is not safe to stay at home, then the opportunities for violence really escalate. And that certainly is what we're seeing mostly in countries around the world. So we're hearing that from China, from France, from Spain, from Italy, from Germany. And in the US, it's a little varied. Actually, there are some communities where the violence has really increased dramatically, like 25, 30%. And in other communities like Denver, for instance, where our local police department is not seeing a tremendous increase in calls, which is curious. And part of what I think we all have to figure out as we're moving forward. So one of the reasons why it is just so incredibly dangerous is that that's where the violence happens. It's where domestic violence happens. It happens at home. And it happens, you know, the root cause is around power and control. And when we're in an environment like we are now, where each one of us feel a complete lack of control, at least I know that's part of our experience. You know, we don't know. We don't know if we're going to get sick, if we're not going to get sick, if people around us are going to die that we love, if how long this is going to go on, if we'll be able to keep our jobs. There's just so many unknowns. So when there is this general sort of feeling of lack of control, those individuals who use violence in order to establish a sense of control in their life, that violence escalates. We also see that that part of the other measures that are being used to address the coronavirus is to shut down places where people gather. And what that's meant is that there's a lot of businesses that are closing down, that are furloughing people. So we have this whole additional level of stress that's being added to families where violence occurs that has to do with, you know, maybe I don't have a job anymore. Maybe I've been furloughed. Are we going to be able to pay our rent? Are we going to pay our mortgage? What about health insurance? So, you know, stress certainly doesn't cause domestic violence, but it can serve to escalate the violence that happens within families. So, the increase in isolation that's happening is also a factor. Oftentimes, families use opportunities to be away from one another in order to de-escalate the violence that's happening. So, you know, that's when you go off to work, there's a period of 7 or 8 hours where there's a sense of freedom and relaxation. You know, when the kids are off to school, that decreases the tensions. If I can leave and go visit a best friend for a period of time, that can make things so much better. So, and none of that is possible anymore without some level of danger. So that also contributes to the potential around violence. What we're seeing here in Colorado are programs that are trying very desperately to keep their doors open. So service organizations that are trying to keep their doors open. Most crisis line work or counseling work has gone remote in as much as they're able to make that happen. Shelters are staying open, but are needing to downsize the number of beds that they have available. The best advice that has come from the CDC and other sources, HUD, is that if you're doing any kind of emergency shelter, that you are keeping only one family to a room. That usually isn't the way most domestic violence shelters operate. They are small enough that they might have a number of beds, a number of bedrooms, and maybe they have 4 beds in a bedroom, and they would have 4 single women, for instance, be in that room, or maybe a parent and a child and another adult. And that's no longer a possibility. So the shelter here in Boulder, for instance, has downsized. They used to be able to house 27 people in their shelter, and now they're limiting to 15. I talked to a program in Kansas yesterday that usually houses about 147 people, and they're down to 80 or 85 people in shelter now. So, so that's concerning, just about the numbers of people that can actually be assisted who are in crisis. There's a lot of work being done with local hotels, hoping either for a lesser cost or perhaps even free that they will open their facilities, because there's very few people who are using hotels for vacationing or business these days, and so the space is available. And so people are thinking creatively about how to make sure that that shelter can be in place and in different ways than we're used to. So just to talk a little bit about what the center is doing around all of this, part of it is that we are trying to increase awareness. So we've had an opportunity to do interviews with about 10 different publications, some of them here in the US, some outside of the US, which has been pretty great. Awareness is important for a number of different reasons. Maybe the most important reason is just to reaffirm for survivors who might be looking for support that the shelter system is open and available to them to help do safety planning, and if necessary, get them to someplace else that would be safe for them, and to reaffirm that going to a shelter doesn't mean that you're going to be infected with corona, which is another major issue for many people. So we're trying to do what we can to respond to the media and help get the word out there. We also so part of what the center does, we have one direct service program. So we work with schools. We do individual and group work with 6 schools in the Denver metro area. And so our staff is busy trying to figure out how to make that happen under these new conditions. So we've been working really hard over the last 3 weeks because each school, of course, operates independently. So figuring out how to get access to parents, how to get access, because we have to do special releases in order to be able to work with kids electronically instead of face-to-face. So we're trying to reach parents, get the permissions, and then reach students so that we can actually work with them during this time, because we know that the violence that some of these students are experiencing isn't coming from their boyfriend or from their girlfriend. It's coming from the violence that happens in their home. And so wanting to be there to be a support to them as we go through this period where there are very few options for young people, probably even fewer than there are for adults. So we're working hard at that. And then a lot of the work that we do is training and technical assistance with direct service programs that are either campus-based or are in rural communities across the country. We've been doing an awful lot of outreach, making sure people are doing okay. We work with about 450 programs across the country. So we've been doing outreach. We've been responding to a lot of concerns. Mostly our work with these programs is around coalition building. So how is coalition a strategy for making change happen around violence in your communities? And so people are sitting in their chairs wondering how on earth, when relationship is so much a part of that process, how do we make that, how do we build relationship when we, see little Brady boxes, and that's the closest that we've been able to get to people. And for some communities, especially rural communities, that's not even a possibility. Internet access is just not real. Even having access to the kind of hard equipment that's necessary can be a challenge. So we're really working with people to figure out solutions to all of those issues. We have developed a couple of toolkits. So we've put out a toolkit for rural programs, and it's more like a fact sheet than it is a toolkit. So it's more like 2 or 3 pages long, but just giving people some support around, taking care of yourself first. And then, yes, these are some of the ideas that you can use to really, from a distance, using social distancing, still work with people and move their work forward during these really tough times. And then I guess, the last thing that I would just kind of throw out there is just is our own challenge as a center. So we're a cash-funded center, like all of the centers at SPA. And this is our 20th anniversary, and we had 20 events planned for this year. And many of them were around building momentum for our major event that's planned for November. But, we rely on sponsorships, on small businesses and large corporations to give gifts in order to make that event financially successful. And the potential of that happening is kind of sad right now. So so there are good sources of money that are coming together to support direct services, but that is not money that would be available to us. So I think we're in a position, like many, many, many organizations, and nonprofits in particular, around just what the solvency of the center will be as we move forward. So it's a major challenge for us.
Thanks, Barb. And you make the point that, we can sort of sit here as observers and with expertise, but as you and I think I heard Danielle and Deserai both mention, and we're all living this and have all kinds of immediate direct impacts in our families and our jobs and all of that too. So thanks for holding that for us too.
Mm-hmm.
Paul Taylor, would you like to share with us from your vantage point, sort of like what are some of these immediate consequences or the consequences to the immediate response that are really relevant for you?
Yeah, so I'm really honored to be part of this group. Definitely have a different perspective and a different kind of research, but a lot of overlap. So I look at how first responders and their organizations respond to unexpected critical incidents, right? And so those organizational responses and then what we put into place after the fact. And what's fascinating is to watch those same dynamics that play out kind of at a micro level, playing out at a national level. And these are just some observations that I've got some thoughts about policing in general, but these are just some general observations that I've had as I've looked at this crisis kind of unfold. You know, one of the things we know about policing is it's kind of a loosely coupled occupation, right? We've got policy and procedure over here, and then we've got practice on the street and how that's carried out over here until we have a critical incident, and then suddenly we're tightly coupled again. And from an outside observer's point of view, looking in, that's an opportunity for us to kind of see how that invisible practice is carried out and where the vulnerabilities are when that occurs, right? So it's an opportunity to look at practice and look for ways to improve. And what's kind of shocking with this as it's unfolded, maybe it's not shocking, but what's just come to light with this as it's unfolded before us is just how close to the margins we actually are operating on a regular basis, right? So we suddenly realize that toilet paper is not available, right? We suddenly realize how brittle our food supply chain is. We suddenly realize how brittle some of those policy and structural responses that we had in place actually are. And one of the questions that I've asked myself as this has unfolded is, have we fallen back on policy and the structures that we've put in place to kind of defend us against these things? Or have we fallen back on the resilience, ingenuity of systems, communities, and individuals? And I would argue that where we've been successful, it's been the resilience of systems, communities, and individuals, rather than the formal structures we have in place to actually combat these types of things. And actually, our greatest failures have probably been around the formal structures that we have, the policies that we have in place. And what's interesting to me, and this is very similar to what happens with a police department and say an officer involved shooting or a critical incident, the tendency is very quickly for everyone to focus on blame. And we see that in this atmosphere as well, where across political divides, already, I mean, we're in the middle of it, but already there's a focus on blame. And as I've studied that in policing, it has been so destructive and really kept the profession from growing and learning from what it does right and from what it does wrong. Yeah, I'm getting a little beyond myself into the next point, but I think it's really important that as we look at this, we look at for ways to structure and strengthen the resilience of our response, rather than focusing on when this disaster is going to strike again, focusing on how we can be more resilient for whatever comes along, whether that, whatever form that may take. And I'll get back to that in just a second. From a policing and first responder standpoint, we're seeing this across the country, that balance between the safety of the worker and the service that they provide. And, we're seeing this now everywhere from our, people working in grocery stores to first responders to our, our medical personnel who are, obviously in contact with this every day. And so how do we balance that? And we're seeing different municipalities really struggling with that balance. Do I continue to send workers out? And we start to understand what really critical function is and what is not so critical, right? And so policing is no longer really looking at some crimes that for a long period of time we've been told are very, very important to holding a community together, and yet our communities are continuing to function a month and a half, 2 months into this process. And so it provides an opportunity for us to reevaluate what is essential and where should we be focusing our needs. The other side to this is that we've also seen the police used in different ways across the country. We've seen the police used in enforcement modes that probably as a society we don't approve of, and it's shocking when we have an opportunity to see that. But understanding that the coercive arm of government, when it's put out there and used that way, it's an opportunity for us to reevaluate how we're using that. The police now are having to enforce restrictions across socioeconomic landscape. So we're not just focused on individual communities at this point where there's problems, it's across the socioeconomic landscape. And now there's suddenly a realization that without community partnership, we're not going to be able to carry anything forward. And I think it's, opportunity to learn lessons from that. We've been talking about community-oriented policing for a long period of time, but until we build those partnerships, and as Deserai talked about, they're essential when we're in a national emergency. We can't do it by forcing people to do it. We have to have compliance. So how do we synergize that community relationship with local government, with state government, and with federal government? And I think those are some key questions that come out of this. I'm rambling a little bit, but really it's an opportunity to look at what we value. Do we value prediction, and how accurate are our predictions on where the next crisis is going to come from? Or do we value responsiveness and capacity? And I think that, if history has been a lesson to us, we'll probably start putting policies in place. We may even build, the next Department of Homeland Security for health purposes. But that's probably not where our next crisis is going to come from. And so how do we build capacity? How do we build responsiveness going forward?
Thanks, Paul. I love, again, just the different ways that we are looking at these issues. And Chris, if you could sort of wrap us up with your expertise in these questions of, this immediate and then these intervening consequences of the immediate response. And what do we know? What should we know? Or what are you curious about from your work?
Yeah, thank you, Lisa. And also thank you everybody on the panel, and everybody who also showed up, watching. It is exciting. I mean, I had no idea what everybody was doing. I had some general ideas, but it's so inspiring actually to hear. And at least I liked how you started this too, just with the comment on uncertainty. And I think that kind of captures it. I think we could add words like ambiguity too, right? And maybe uncontrollability, so many unknowns. And I think just it creates a situation for us personally, professionally, just this need to kind of make sense of it, maybe contribute, draw meaning, understand. And I think I think that leads to how we respond and take action, and even assess those actions. And so, at least when I was dealing with or thinking about and being exposed to this myself, I was thinking what ways do because I don't do direct research on crises. Some of my research may indirectly touch upon it. What can we do? And there's different ways we can think about this. I mean, part of it is like taking our current research that we have going on, and because I think all of our research is affected by COVID-19 and the pandemic. And a lot of the research I'm doing now with Tanya Heikla and others on oil and gas, that industry has been hit hard by some global developments, but also COVID-19. And we're adapting the research we have going on right now, and we'll be looking to expand that research maybe to help, understand that situation. And then there's also kind of interesting too. There's as a scholar, we represent not just our research, like a particular study, but also just almost like a broader community of knowledge. And questions arise like, how do we translate that knowledge into something that can help us understand? It won't tell us exactly what to do in that particular situation, but it does give us understanding and meaning. And also it's beyond any one of us to understand that meaning, to draw it. So that's where, for me, what I did, I just pulled together 9 scholars, including Tanya and Deserai, and asked them to talk about how do we interpret this? What do we make sense of it? What do we do? And hopefully we can share that. That's coming out in a journal, and it's been accepted. We have the proofs now, and it's just different perspectives on this crisis from different angles of public policy and policy studies, and with a global kind of comparative perspective. It's amazing. If you are living in Sweden to Czech Republic to the UK to Australia to China, you are experiencing this differently. And just like if you live in Denver, there's such variation even in this one city about how people are experiencing this crisis. I don't think that's something we've actually grasped. And then there's questions of, how do we take our research and do new research? And this is where it's like just hearing people, I'm like, oh, this sounds so exciting. But, right now I'm kind of fascinated, similar to what Deserai was saying about, there's a surge of policy decisions right now being made, and all those decisions are being legitimized, being justified by our government leaders, and how well that's done leads to their success in compliance, maybe overcoming conflict, maybe the need to persuade instead of coerce behaviors. And so, I'm looking to understand how our government leaders are actually, justifying what they're doing, actually, and eventually see if that makes a difference in those outcomes. And that involves the trickiness of how science is used and how science is intermixed with emotions and other kind of ways of rationalizing, what we're doing, actually. And so, I can go on about some of the lessons I think we can find from the field, but let's move on. Thank you.
Thanks, Chris. You got us started too, thinking about this future. And so I'd love to ask, any one of you who might be thinking about this too, in addition to what you talked about, this immediacy, how do you think, are there ways that you're already seeing you're going to approach your work differently? And what are you wondering about for the future? Are you even there yet? Maybe you're not even quite there yet. Is there someone that wants to start? Deserai? Yeah.
Sure. So I'll give 2 examples of just kind of how my broader resilience and disasters work, and then also specific projects are evolving kind of from these questions I was asking. I mentioned this collaborative project that I'm putting together with some colleagues that might be a rapid, maybe it'll turn into something else down the road, but really we're coming together from public health, kind of behavioral economist folks, a lot of policy and specifically disaster policy, and then a couple of us who do NPF communication, narratives, messaging type of work, to think about the role that those risk communication messages in a situation like this, where we don't have fixed beliefs, because this, at least in the US, feels very new. In a lot of other, in particular, Asian countries, where they grappled much more with the potential of a huge SARS outbreak or other examples. For them, it's not as novel, but because it is so new, how do we think about the role that communication plays in shifting risk perceptions of individuals? And like Chris was talking about, whether or not a government has to be coercive, or the degree to which an individual is willing to cooperate with voluntary actions. Even in Colorado, where we've done a fair amount in terms of policy making, the mask wearing and so forth is still very much voluntary, unlike in New York City. So asking those questions that relies a lot on the ability to go and survey in the field within the next couple of weeks, because we want to follow that as the policies change over the next, 6 months, let's say. The other thing is I've done a couple of contract surveys. Last year, I did one for the Colorado Resiliency Office, which is a part of the Department of Local Affairs. And this summer, the next month, I'll be doing one for the Colorado Energy Office. Both of them wanting to understand how local governments view various risks and their ability to change and adapt, whether it's about local government resources, whether it's about their understanding of risks that they face. And it's interesting because given this moment in time, the folks from the Resiliency Office from last year's survey have come to the Energy Office and said, could we ask a couple of the same questions that Deserai asked last year? Because it'd be really interesting. For example, last year, we asked them kind of the extent to which they think a number of different risks constitute one aspect of resilience. And those risks were everything from, fires and floods and drought to economic crises to public health crises. And it was really surprising to me that public health crises were one of the lowest ranked in terms of whether or not local governments view that as part of the resilience puzzle. And it will be interesting to see if this year they have a different perspective on that. So also just kind of seeing how something like this can change not only obviously the resources with the economic crisis, but just how governments are viewing these risks that we face.
Yeah, what an interesting opportunity. Again, as a public health person, I'm like, of course these are risks.
Yeah, of course.
But reality is not everyone sees them that way. How about someone else? Just, what are you thinking about for the future of your own work and research?
I can just pipe in. It's going to be profound. I mean, I don't think there's a corner of our society that's not touched by this, and so it will affect. I think every topic that we can think of in some way or the other. It ought to affect our teaching also. It's not like things have gone away or completely changed, but when we think of be it domestic violence or oil and gas or health, education, I mean it's going to be everywhere. And I think it's kind of interesting with scholars. I mean, what's cool about School of Public Affairs is that we have scholars right on the front line doing work like Danielle's doing the great work that Barb's doing. And then we have scholars who aren't. And we also have scholars who are doing work that with immediate impacts that have a certain type of style to it. We also have scholars that our specialty might be contributing insight 3 years from now, what's happening now. And all that has extreme value in our society because it just provides an understanding and also helps us kind of move forward in what we're doing in terms of governance and politics and managing our dilemmas.
Thanks, Chris. Great way to articulate that. Danielle, do you want to talk a little bit about your sort of seeing your future?
Well, I was just going to comment. The most immediate thing I've seen research-wise is, I think everyone's probably experiencing this. Like right now, probably, every data collection effort that is happening in community, I do community-based research, is halted. I'm also in public health, so there's a lot of happening there. But all data collection on every project that I'm on is delayed. So there's that, and a real unknown right now for when are we going to be able to do it. So we work on a project with the Rocky Mountain Prevention Health Center at the School of Public Health, and they're saying, well, CDC, we need a time one because our CDC grant is on a time frame, a 5-year time frame, and they were like, we need to get this time one done, but by June or else our 5-year time frame is going to be off. And the community partners on the call are like, yeah, now's not a good time. I wouldn't, submit that, put that survey out. So, and I was asked on that call, what do you think, Danielle? And I said, as a community-based researcher, there is absolutely no way I would ask a community to do a survey right now. So research is being delayed at the community level in all kinds of ways. And I think also really importantly is that research, unless it's around right now pathogens, or vaccines and these kinds of things, it is novel. So, I have a lot of people asking us, like, how do we capture these moments right now and learn for them and become more resilient? But it is novel research, and so it is not the priority for funding. So I think, there's a health system that we are working with who said, we have a bunch of money for a project, and it's all on network science stuff. And they came back and said, our funder just allowed us to use all of that money to for personnel and overhead. So now we're going to pay our community health workers. They were going to be done in June, and now they get to keep their jobs through December. And so all the money going to research from that health system now just went into personnel. And I'm like, amazing, like that's amazingly great stuff. And it means we won't be doing research. So research, I think, is novel and secondary right now in the middle of a pandemic, in the middle of a crisis. So I think that's something that's going to really have a ripple effect, like all the other things. The only other thing I wanted to say real quick is, and Lisa and I work on this together, we're putting on this event, the Network Innovation Summit, on May 18th. And when all of this happened, the event was an all-day event in person at the Tivoli, and it's a collaboration we have together. And we had to make a decision, on what to do. And the event is on the future of networks. And we decided, well, why don't we theme it around networks in times of crisis and just make it really relevant? And we had a call today with all of the speakers, and it's just an amazing set of people who are coming together to talk about this very question kind of that you asked, like, what are all the ripple effects, both upstream and downstream, of this event, and what are the consequences we're going to see in 3 months and 6 months and 12 months, whether you're in criminal justice, or you're thinking about higher ed and K through 12 or health systems. And so I think people right now are really looking for a place to really digest and think through these systemic problems. And I mean, I'm talking about like the people sitting in their houses right now, like need a place to be able to like talk about the problems and talk about the systems in place and worry about them. And we don't really have that space because we're confined right now and we don't have forums for that. So I think as academics or people with this kind of privilege that we have right now, we could host those spaces, and we could really help people have that kind of cathartic thing that they need to really be able to flush out, like, what is happening now and what are the systemic solutions, what can we do for the future? So I think there's a role we can play that might be really unusual as thought leaders, and especially to give space for people to be able to contribute to the conversation.
Thanks, Danielle.
So
we have some questions. And so I just want to see, Paul or Barbara, if you have something quick that you want to wrap up with this future conversation so that we can move to our question.
Oh, I was just going to add that there's actually some really interesting conversations going on right now within the domestic violence community, because life is so different now than it was even a month ago. And it really seems to be opening up people's ideas and their thoughts about what this work should look like in the future. So, for instance, this woman in Kansas that I was speaking to, she said, we're really beginning to question, so why did we ever have 147 people in this shelter at one time in the first place? Did that really make sense around the quality of service that we could provide to these people? There's always that urge to be able to create safety for as many people as possible, but what really were we doing? So I think this is an amazing opportunity for people to rethink where we are, where we've been, and what might be possible for the future.
Great, thanks. And Paul, any other sort of future wrap-up thinking from you?
No, I just think there's a tremendous opportunity right now. Just like where we have critical incidents in policing, those provide a juncture, a point for us to look at how practice is currently carried out, where our weaknesses are as a system, as a society, as communities, and how we can strengthen those going forward. It's a tremendous learning opportunity if we allow it to be. But I think oftentimes we squander that, and I hope we don't this time.
Thanks. Well, I hope for everyone watching that this has been as interesting and thought-provoking for you as it has been for me. I love, Chris, your comment about a lot of our work is this sense-making as well, and sense-making from so many different perspectives that's so powerful, and reminders that sometimes in our own work we're a bit self-isolated, so it's lovely to hear from each other and to share. So I'm going to close this part by saying thank you to all of our panelists, and Tanya and Emma and Nate for helping coordinate this.